Welcome to Amber's Biopod. I am your host today, Amber Lynn. I'll be talking about corneal ulcer. It is an eye disease many people do not know the seriousness of, especially to contact lens wearers. While many might know thoroughly about coronavirus, you may have little knowledge of this. I will be talking about what it is, how you may get this eye disease, how your eyes are affected by this disease, the symptoms, diagnosis, and the cure of this disease. Hope you enjoy it! You must be curious how I got to know this particular disease you may be unfamiliar to. Well, long story short, last summer I was going on a trip, and while I was in the wild, I rubbed my eyes not knowing my ulcer is damaged. I got hospitalized for a week and with the risk of getting sightless. Now you may know how serious this disease is and how it is unnoticeable. First and foremost, let's get to know this disease. So, what exactly is corneal ulcer? There's a crystal-like layer covering your iris, called the cornea. It is the only layer separating our eyeballs and the atmosphere. Tears wash out the foreign things from the cornea, like bacteria, viruses, fungi, dust, and many more. Although cornea may block out things from the outside environment, it is very sensitive and fragile. When there's an injury, even if it's just a little tiny scratch human eyes cannot see, it causes an infection. Even worse if you're a lens user. Now you know what the disease is, but what can cause corneal ulcer? Is there any way to prevent it from happening? The biggest victim of corneal ulcer is contact lens wearers, because they can easily cause irritation to eyes, which can result in corneal ulcer as the contact lens may rub against the eye surface, creating just a slight damage or scratch to the epithelium, which is the thin tissue of the outermost layer of our human body, can enable bacteria to penetrate the eye. Most cases of corneal ulcer are due to a bacterial infection that invades the cornea, often following eye injury, trauma, or other damage. Besides bacterial infection, other causes of corneal ulcer are fungi and parasites. First is Fusarium. These fungi have been associated with fungal keratitis outbreaks among contact lens wearers who used a certain type of contact lens solution. Now withdrawn from the market, this contact lens solution previously failed to prevent this type of infection. Second is Acanthamoeba. These common parasites can enter the eye and cause Acanthamoeba keratitis. It is a serious eye infection that can result in permanent scarring of the cornea and vision loss. Acanthamoeba microorganisms are commonly found in tap water, swimming pools, hot tubs, and other water sources. Contact lens wearers who fail to remove their lenses before swimming significantly increase their risk for a corneal ulcer from Acanthamoeba keratitis. Another cause of corneal ulcer is herpes simplex virus infection, also known as ocular herpes, which can damage exterior and sometimes even deeper layers of the eye surface. Other underlying causes of corneal ulcers are severely dry eyes, eye allergies, and widespread general infection. Immune system disorders and inflammatory disease, such as multiple sclerosis, which is abnormal hardening of tissues, and psoriasis, which is in skin disease of itchy eye patches, also can lead to corneal ulcers. Here are some symptoms you may notice before you're aware of the corneal ulcer. Signs of an infection of your corneal include itchy eye, watery eyes, pus-like discharge from the eye, burning and stinging sensation in the eye, unusual red and pink eye, sensitivity to light. If it have already gone serious and became a corneal ulcer, the symptoms are eye infection, sore eye, excessive tearing, blurred vision, white spot on your cornea, swollen eyelids, pus and eye discharge, sensitivity to light, and feeling something foreign in your eye. Once you feel you might have corneal ulcer, you must immediately go to an ophthalmologist and they will diagnose it with eye disease. Here are the ways they diagnose it. An eye doctor can diagnose corneal ulcer during an eye exam. One test used to check for a corneal ulcer is the fluorescein eye stain. For this test, an eye doctor places a drop of orange dye onto a thin piece of blotting paper. Then the doctor transfers the dye onto your eyes to lightly touch the blotting paper to the surface of your eye. Then the doctor uses a microscope called the slit lamp to shine a special violet light onto your eye to look for any damaged areas on your cornea. Corneal damage will show green when the violet light shines on it. If you have an ulcer on your cornea, your eye doctor will investigate to find out the cause. To do that, the doctor may numb your eye with eye drops, then gently scrape an ulcer to get a sample of the testing. The test will show if the ulcer contains bacteria, fungi, or a virus. Once your eye doctor discovers the cause of the corneal ulcer, they can prescribe an antibacterial, antifungal, and antiviral eye medication to treat the underlying problem. If the infection is bad, your doctor may put you into antibacterial eye drops while they test for ulcer scrapings to find out the cause of the infection. In addition, if your eyes is inflamed and swollen, you may have to use chlorosyroploid eye drops. During this time, it is best to avoid wearing makeup, touching your eyes, wear a contact lens, and take other medications. After the cause and the symptoms, you may have an idea of how the eye is affected, both short-term and long-term. In the short term, you'll feel extreme pain as the infection grows worse. If serious, grow sightless. Long-term effect, like some people may also develop a severe loss of vision along with visual obstruction due to scarring over retina. Corneal ulcer may also cause permanent scarring on the eye. In rare cases, the entire eye may suffer damage. Although corneal ulcers are treatable and most people recover quite well from after treatment, a reduction of eyesight may occur. Now, let's talk about the treatment. If your ulcer is serious, your ophthalmologist may suggest you to do a corneal transplant. A corneal transplant involves in the surgical removal of the corneal tissue and its replacement with donor tissue. According to Mayo Clinic, a corneal transplant is a fairly safe procedure, but like any other surgical procedures, there are risks. This surgery may cause future health complications such as rejection of donor tissue, development of glaucoma, eye infection, cataracts, swelling in the cornea. There's no turning back once your cornea is damaged, so make sure to take care of your eyes properly. Talking about taking care of your eyes, here are some tips and ways to prevent corneal ulcer. If you are a contact lens wearer, you can increase your chance of avoiding a corneal ulcer by practicing good hygiene, such as washing your hands before handling lenses and following other safety tips. The best way to prevent corneal ulcers is to seek treatment as soon as you develop any symptoms of an eye infection or as soon as your eye is injured. As you may notice from the signs of corneal ulcer, all symptoms are severe and very noticeable. If you see similar signs, you should go to an ophthalmologist and treat it immediately to prevent blindness. Although the symptoms are significant, a corneal ulcer looks like a gray-white area, and even sometimes too small to see without magnification. That does not mean you can ignore it. Other helpful preventative measures include avoiding sleeping while wearing your contact lenses, cleaning and sterilizing your contacts before and after wearing them, rinsing your eyes to remove any foreign objects, and always remember to wash your hands before touching your eyes. To conclude, corneal ulcer is an open wound on your cornea. Bacterial, fungal, and viral infections may cause it. A doctor can diagnose it by testing it with an eye test. Symptoms include red, watery, swollen eyes, and a feeling of foreign body in your eyes, etc. The eye can go sightless if you're serious, and reduction of vision if light. Prevention is to follow the hygiene procedures properly and get treated immediately once it occurs. Thank you so much for listening, and I hope it helps you. I personally went through all of the processes mentioned, and it was one of the horrific things to happen in my life. Never ever forget to wash your hands before touching your face and your eyes. Once again, thank you so much for listening, and I hope to see you guys next time. Make sure to tune in to AMP's Biopod episode 2. Bye!